Hi, welcome back to Talk Local. Now we have Kitchener-Conestoga MP Harold Albrecht in studio with us, starting the national conversation about health and suicide prevention. He's introduced a private member's bill, that's C-300, that would institute a federal framework for suicide prevention. And Harold, that really is one of the key things, isn't it, is to put this forward, to attempt to get this into law, but really opening the doors, the lines of communications to start talking about this, right?
Exactly, and I think even the conversation that we had in Parliament among MPs, just the fact that this is a national conversation that we're having openly, even this program tonight, having an open conversation here for the region of Waterloo, having the ability to speak openly about it and to hopefully remove some of the secrecy and stigma around it. This has been something that has been birthed not just in my mind, but it's been birthed through people like the Waterloo Regional Suicide Prevention Council. I will never forget about a year ago receiving an email from Tana Nash, who you'll be speaking to later this evening. And she was calling to us as members of Parliament from the Waterloo region, please do something in terms of a national strategy or a framework. Last week, she said in her email, 3 suicide deaths in Waterloo region high schools. And that just really grabs your attention.
Hi, welcome back to Talk Local. Well, one local MP is hoping to start a national conversation on suicide prevention. So, as mentioned earlier, Kitchener-Conestoga MP Harold Albrecht introduced a private member's bill, C-300, that would institute a federal framework for suicide prevention. Harold is still in studio with us, and we also have Tana Nash, who's the coordinator of the Waterloo Region Suicide Prevention Council. So, welcome, Tana. Thank you for your time tonight. Right before the break, we were talking about you a little bit as you sat in studio. Harold, mentioned how you'd called him, you'd sought, some help and said this is a major issue. This is something that we need to deal with. Pleased then, I guess, that Harold has taken the steps. It's being discussed, and that maybe there will be some attention paid.
Absolutely. I needed to get political support as well, and for other people to realize what's happening in our region. And because you're right, because we don't talk about it as much as we should be talking about it, then people don't realize what's taking place. And sometimes you just have to have that communication and be able to share what is happening in the region. And dialogue, I believe, is the first key and the first step, because we need to have a dialogue about this. We need to talk about it, because invariably, whenever I go out and talk about it, it's not a topic that people bring up easily.
Right.
It brings up a lot of emotions. You're very vulnerable. But once I start the dialogue, people want to have the conversation. Or I'll make a presentation and people will come up to me afterwards and say, I've been touched by suicide, and share their story. And so once somebody starts the dialogue, people want to talk.
Harold, are you finding the same thing? You were saying that it was getting support from all parties, which is great. What are your constituents saying? Have you heard any? Have they approached you speaking about this at all?
Yes, in fact, earlier I mentioned that the motion M388, which dealt with internet predators, actually opened the door for many conversations about the more general topic of suicide. But since I've tabled C-300 as well, I've had local residents come to me, and as Tana said, they will say, for example, about 2 weeks ago, a little more than that, someone came up to me and said, I appreciate the work you're doing. My son, I think he said 37 years old, ended his life by suicide. And it's not the kind of conversation we would have had I not tabled this motion and opened the door to make it easy for him, somewhat easy for him to begin speaking to someone who I don't know him personally, but he's a constituent and felt that he wanted to express his support based on his personal experience.
And 37 years old, is that something that we expect to see, or do we think it's mostly, young kids, or is there any demographic or race, sex, anything, or does it just really cover everyone?
It does cover all spectrums. I think youth do garnish a lot of attention because it is the second leading cause of death among our youth, so that's pretty scary. Total number of deaths across Canada, males predominantly.
Males.
35 to 55. And so that's a whole demographic. And suicide also touches the elderly, people that are isolated and feeling alone. So, with Harold's bill that is currently in the House, there's so many different levels. There's so many different demographics that it touches, and there's many different prongs to it, right? There's prevention, and talking about it in dialogue, and what are the warning signs. You know, think about heart and stroke and what we see with heart and stroke even on national television. Well, let's talk about what are some warning signs so we know what they are, and what to do if somebody is seemingly that they are thinking about taking their life. And then we have intervention. And what are we doing for intervention and crisis and management? And then we also have what we call postvention, or helping folks out that have taken their life. Sandra, on your lead there, the social worker from the Catholic Board, talks about that, and some of the best prevention can also happen with postvention. So these folks that might be harboring this grief inside and not dealing with it are also at a high risk of taking their own life.
Okay. And I imagine that would be because it has been so taboo or so much stigma around it, you wouldn't even feel comfortable maybe, right? Talking to people about
I could
it.
just share a very personal illustration, and I wasn't planning on doing this, but when you talk about grief, I've had some grief in my own family in these past 6 months, and it's been a difficult journey, but in many ways a good journey because of the support I've had. But I can't imagine layering onto that grief the questions of what could I have done to prevent, or what should I have done, or why didn't I see a particular sign or signal. So suicide prevention is everybody's business. This won't be solved by groups like Waterloo Regional Suicide Prevention Council alone. It won't be solved by federal action alone. Everybody has to have their awareness increase so that we're more open to asking those hard questions sometimes.
Oh yeah, absolutely. And do you find there's some hesitation there to ask that question of ourselves, you know, whether it's a family member? And I imagine there would be reluctance as well. You know, if you are in distress and you are upset and you are thinking about it, I don't think many people, you know, come right out and say, I'm thinking of suicide. So how do you connect those two sides?
Well, I think education is definitely the key, and I think there's a lot of myths that need to be broken down, and one of them being that if I ask somebody if they're thinking about taking their life, that will make them go and take their life. And so there are these myths that have permeated into our culture, and we need to break those down to let people know that it's okay to say those words, because if somebody's already been thinking about them and they're rolling through their head, they're going through that all the time. They're having suicidal thoughts, and it's okay to ask the question. As uncomfortable as it is and as nerve-wracking as it is, it's okay to ask that question.
And I mean, that could potentially save someone's life, push them to get that help. I think a lot of it is just being alone, right?
Absolutely. And I think that whether you're speaking personally to someone or encouraging to find the professional help by giving them a distress line number or whatever it is, that whatever step you feel is appropriate in that situation. Tana's certainly had much more experience in dealing one-on-one with those kinds of people. I'm not the expert on suicide. I'm simply saying let's bring the experts together and get that information collated and shared. And any research that may be sitting on the shelf, so to speak, get it into the hands of people that can use it.
That's the thing, right? Use it. We always say, you know, knowledge is power. So the more you know, the more you're going to be able to help someone else out. And do you find that people are, I mean, you and other organizations and with government all working together for this common goal, right? This is not something that's touchy or iffy. I think everyone's on board with this.
Oh, absolutely, and it's been a long time coming, as you mentioned, right? We're the only developed country that does not have one, and it's not because one hasn't been formulated. The Canadian Association developed one many years ago, but to get the funding and to get it off the ground. And what's been taking place, there are grassroots organizations such as ours across Canada that are doing fabulous work, but we need that coordination of services so that somebody out east isn't reinventing the wheel of something that's already taking place out west.
And they could just find that information and use it.
That coordination of a federal body can certainly help to disseminate the information, to look at best practices, to look at the developed countries around the world that are leaps and bounds ahead of us, that have implemented suicide prevention strategies.